Hey guys, good morning. This is Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness. I'm also the founder of this running injury support group, and I just woke up myself. It is 8:30 in the morning, but I wanted to get on and talk for just a couple minutes. And I guess what I wanted to talk about was, what would it do for you? How would it change your life if you could treat your own pain? Specifically your knee pain. I believe the IT band syndrome was the most common diagnosis that people have had in this group. So that runner's knee. Hey Matt, how are you? It's good to see you. Between runner's knee, patellar tendonitis, IT band syndrome, just generalized knee pain. Maybe pain that you don't exactly know what to call it. Might not have a fancy name for you yet. You might not know exactly what the diagnosis is. Sometimes the diagnosis isn't super important. But what would it do for you if you could say, do a self-assessment? If someone was to guide you through and say, here's how you check your hip mobility, here's how you check your trunk mobility, your knee ankle mobility. How about strength? What if you could give yourself a rating for your strength? If you can do X, Y, and Z, you have this rating. If you can do A, B, C, you have this rating. What would it do for you if you could do your own assessments of strength and mobility? Because as physical therapists, that's what we're looking at. If you're having pain, we'll talk about the knees. If you're having knee pain, having trouble staying live here. If you're having knee pain, what we do is we go through and we check your physical impairments. We look at your running schedule, your training schedule, your history of injury. But what if you could look at those things yourself and come up with a conclusion as to what steps to take, where to go next, if you had someone to guide you through that? Seems like it would be beneficial if you could know the signs of incoming knee pain or incoming injury, that you could take steps to prevent those things from happening. You'd be able to stay running, you'd be able to stay training, you wouldn't have these long periods where you weren't running. So just something to think about. That's one of the aims of this group. But if you could do those things, what would it mean for you? Would that be valuable? Would that be something that you'd be interested in? If so, comment below. Please like and share this video. Keep your eyes open. Some of you may have received an interesting email this morning around 8 o'clock. If it's not 8 o'clock in your time zone yet, keep your eyes open for that. It may go to the promotions or the junk mail, but you're going to want to look at that and see what's in there. Because I have some pretty cool stuff coming down the line. And a lot of it's going to be announced through your email. Once it's released through the email, I'll announce it here in the group. So I'm pretty excited about it. So hopefully you guys find value in what I've been working on here. So good morning, Letty. Good morning, Michelle. How are you guys? But I'm going to go ahead and get off here and eat some breakfast. But it's good to see everybody. And make sure you go check your email, okay? And once again, this is Dr. Cameron Dennis. I'm a physical therapist with Back on Track Therapy and Wellness and the founder of this group. So if you have any questions, please feel free to comment below. Thank you. Bye.